there! Baby Doc here with some sage advice for expectant parents and newborn healthcare professionals about essential terms and definitions related to neonatal lung volumes and capacities. Each lesson in this series is designed to build upon the last, creating a strong foundation of knowledge that leads to true competency, confidence, and clinical excellence in neonatal care. Understanding these concepts allows clinicians to interpret respiratory status, manage ventilation effectively, and support fragile neonatal lungs with precision and safety. These terms include 1. Tidal volume, VT, is defined as the volume of air inhaled or exhaled during a single breath. In neonates, the typical tidal volume is approximately 4 to 6 milliliters per kilogram of body weight. This represents the baby's gentle everyday breathing effort, the normal in and out exchange of air that occurs with each breath. 2-minute volume, VE, also called minute ventilation, refers to the total amount of air inhaled and exhaled in 1 minute. It is calculated by multiplying the tidal volume by the respiratory rate. This measurement tells us how much air moves through the lungs every minute and helps evaluate the adequacy of ventilation in the neonate. 3. Functional residual capacity, FRC, is the volume of air remaining in the lungs after a normal, passive exhalation. It acts as a small but crucial air cushion that keeps the alveoli partially inflated between breaths, preventing atelectasis and ensuring continuous oxygen exchange. Maintaining an appropriate FRC is vital for stable gas exchange in neonates. 4. Vital capacity, VC, represents the total amount of air that can be moved into and out of the lungs during one maximal breath. It includes a full inspiration, followed by the deepest possible exhalation, demonstrating the complete range of usable lung volume in a healthy baby. 5. Residual volume, RV, is the amount of air that remains in the lungs after a maximal exhalation. This air cannot be exhaled, even with effort, because it serves an important purpose of maintaining alveolar patency and permitting ongoing gas exchange between breaths. 6. Total lung capacity, TLC, refers to the maximum amount of air the lungs can hold after a full inspiration. It encompasses all the smaller components of lung volume, including tidal volume, inspiratory reserve, expiratory reserve, and residual volume combined. In neonates, the total lung capacity is small, but grows rapidly as the lungs mature and expand post-birth. 7. Resistance in neonatal ventilation refers to the opposition to airflow within the airways, endotracheal tube, and ventilator circuit. It is influenced by the diameter and length of the airways, the presence of secretions, and the smoothness of the inner airway walls. In neonates, even small changes in airway diameter, such as from edema, mucus, or improper tube size, can significantly increase resistance, making it more difficult to move air in and out of the lungs. 8. Compliance describes the ease with which the lungs and chest wall expand during ventilation. It reflects the elasticity of the lung tissue and thoracic structures. In neonates, compliance is often reduced due to factors like surfactant deficiency, stiff alveoli, or chest wall immaturity. Low compliance means the lungs are stiff and require higher pressures to achieve adequate ventilation, while high compliance indicates overly flexible or floppy lungs that may not maintain adequate gas exchange without careful ventilatory support. Finally, the inspiratory and expiratory reserve volumes, IRV and ERV, provide additional insight into breathing potential. The inspiratory reserve volume represents the extra air a neonate can inhale beyond a normal breath, while the expiratory reserve volume is the extra air that can be exhaled after a normal exhalation. These reserves explain how the lungs adapt to stress, increased activity, or assisted ventilation. Together, each of these terms form the foundation of neonatal pulmonary physiology. By understanding tidal volume, minute ventilation, functional residual capacity, vital capacity, residual volume, total lung capacity, resistance, compliance, and the reserve volumes, providers can more effectively interpret ventilator settings, recognize when lung volumes fall beyond safe limits, and ensure optimal ventilation for their tiniest patients. In our next lesson, we will cover methods and types of ventilation. Be sure to like and subscribe to McGlinn Institute Neonatal. And join me, Baby Doc, for more sage advice.